Now, as you're formulating your questions, we will have a few minutes to talk here. I want to just start off by highlighting something that will be very obvious to the veterans in the room and not so obvious to others. You didn't hear anybody talk about a chemotherapy trial. You didn't hear anybody talk about the kinds of therapies that we have made so much progress with over the past few decades. This is not to diminish it. It's actually critical, and many of the therapies that you heard discussed will ultimately end up partnered with chemotherapy for good reason. But the part that I think is so interesting and important for everybody here to understand is these all represent real advances based upon a more fundamental understanding of the biology of the cancer, and we say host, we mean the person with cancer. And this is what's so exciting because, A, it means ultimately the development of more effective and less toxic therapy, which is everybody's goal. And the second is it starts to transcend old-fashioned understandings of disease type. Everything you heard about, and you guys can correct me if I'm wrong, is not really narrowly and only specific to breast cancer, right? So Jed talked about melanoma. The angiogenesis inhibitors that Kathy has spoken about are in broad use for a number of diseases, well beyond breast cancer, even some benign illnesses. And the kind of gene therapy that Gabe discussed, of course, would have applicability broadly. And the PI3 kinase pathway is important where else, Jose? Not just in breast cancer, right?
Yeah, in colon and in lung cancer as well.
And uterine?
Yeah, as well.
Right.
Yeah.
So, I mean, it just makes the point that these advances really start to have payoff outside of the area that you might have initially thought. I frequently think of the space program, which everybody says, well, got us to the moon, and it did, but it also got you ultimately the iPhone. And seriously, and a long list of huge spin-off advances that weren't the intended goal, but they were, in fact, a consequence of it. So with that, I do want to give everybody the opportunity to ask questions if you have any. Raise your hands, and I think we have microphones, or I can just shout out and repeat them, right?